Coronavirus disease 2019, commonly referred to as COVID-19, is a new respiratory illness that can easily be spread from person to person. COVID-19 is spread through contact with droplets produced by an infected person who is sneezing or coughing, or contaminated surfaces or objects. The first case of COVID-19 was confirmed in Kenya on 13th March 2020.
The Ministry of Health has confirmed the first coronavirus case in Kenya.
And since then, over 350 people in the country have contracted the disease, proving the high spread of the risky virus. Abnormal times like this caused by the COVID-19 pandemic call for different measures and change of the normal to ensure safety.
The nationwide dusk to dawn curfew that is currently in force shall also be extended for a further period of 21 days.
The government of Kenya has been releasing various guidelines to ensure safety and containment of the virus. Ripples International has put up measures to supplement the government's efforts in containing the spread of the virus. These measures include coming up with a task force to update the staff on COVID-19, safety guidelines for staff working directly with the children at the shelters, and admission guidelines for children at the shelters. In compliance with the government directives on social distancing, the Ripples International management has provided means of transport to the staff members to avoid usage of public transport as a safety measure of containing the virus. The staff are required to be in their face masks at all times while in public places. They sanitize their hands while boarding the bus and maintain social distance while being transported to work.
My name is Jennifer Muredi. I am one of the staff at Ripples International, serving as the executive assistant to the director and tasked with the role of being the chairperson of the RI COVID-19 task force. We have a hashtag that says stay informed and stay safe. So that basically explains our work. Our work is to ensure that the staff at Ripples International, one, we stay informed, and two, we stay safe. And how we do this is there's so much that information that is out there with regards to COVID-19. Some of it is not true, some of it is true, and some of them are myths. So our work is to get this information and be able to verify what is true. Then we disseminate that information to the staff using the various forums that have been provided by the organization.
On arrival to Ripples International main campus, the staff as well as visitors are directed to wash their hands at wash points provided at the gate, and their body temperatures are taken as a safety precaution. Safety guidelines on coronavirus are provided at designated points at Ripples International premises to pass information to all staff and visitors. To observe social distancing while at work, Ripples International have embraced staying at their workstations unless it is absolutely necessary to move. They have also embraced other safety measures including avoiding multiple touch of surfaces, observing regular hand washing, and holding online meetings as an alternative to physical meetings.
Asha, we are waiting for you. Tessie?
The staff working at the shelters who interact directly with our children, that is at Tumaini and New State Center, are required to wash up on arrival at Ripples International before interacting with the children. All staff are required to be in the face mask and gloves at all times.
Hi, my name is Anne. I'm a social worker. I work at Ripples Tumaini Center, and here to tell you about the measures that we've taken in the shelter to ensure that our children are protected against the spread of COVID-19. At our shelter, we have minimized movements of our children. We don't have children going out unless it's really very necessary for them to do so. We've also ensured that our staff maintain and follow the guidelines that the government has given towards preventing the spread of COVID-19. We have our staff come in wearing masks. We have educated the children on how to keep themselves tidy and clean their hands and sanitize. These they know. We've also bought masks for them to put on anytime that they are going out of the shelter. We are taking temperatures of our children and reporting on a daily basis to the management on their health well-being.
My name is Mercy Gasheri. I'm a social worker at Ripples International, currently the HOD at New Start Center. New Start Center is our shelter for infants 0 to 3 years. We have taken a number of measures to ensure that the children in our care are protected and they are protected from the virus. During the day, we have put in measures to ensure that children are not at the same place, they are not like crowded in one place. We have set aside different sections for the babies at different times. We ensure that they are well fed and that the nannies in charge wash their hands and sanitize at every point.
One of Ripples International core values is responsiveness. With this regard, we have created awareness about COVID-19 to various self-help groups and other community groups that we work with.
Keep distance with one. What we have 1.5 meters. Alafu inaingia ukora. Unaona? Kwa dira ukora. Kana kuina karatasi ukora. No atano wadiri hata. No atatibu. Amambia yako wata. Wote wati kwa mtu wapi hapo? Unaona? Wati wenda bwena. Nyata hiyo tu okay. Unaona?
As a ripple effect to the awareness created, women have disseminated materials on COVID-19 in the local language as provided by the Ministry of Health. These posters were distributed in the community. The women have also established hand-washing points in strategic areas in their community. Ripples International has also been handing out humanitarian food relief baskets to families in the community that have been affected. Ripples International put together a task force of 5, namely Linda Gishuru, Prince Mwenda, Mercy Gasheri, Calvin Moses, and Jennifer Munge, who endeavor to keep the staff and management well updated and informed with verified factual information as we all fight the COVID-19 pandemic. Through the leadership of Ripples International COVID-19 Task Force, we have joined the nation in the Necessitated campaign to celebrate those in the front line in the fight against COVID-19 pandemic. The Ripples International Advocacy Team is also working with the Ministry of Health on creating awareness on COVID-19. This is through the available mass media communication channels such as radio talk shows and TV shows to disseminate information on COVID-19. Ripples International, together with other non-government organizations like the Kenya Red Cross Meru Branch and Jipiego Afya Kamilisha Meru, have been enjoined to Meru County COVID-19 Emergency Response Team. Ripples International was enjoined so that it could support the community and the government in order to contribute to the prevention, management, and recovery from the COVID-19 pandemic. For more updates, follow us on our social media platforms.